Hello, and thanks so much for joining us today. I'm Carol Jenkins. The program is Black America. My guest today is Dr. Uché Blackstock, an emergency medicine physician and founder and CEO of Advancing Health Equity. Dr. Blackstock received her undergraduate and medical degrees from Harvard University and was recognized by Forbes magazine in 2019 as one of the 10 diversity and inclusion trailblazers you need to get familiar with. She joins us today to discuss her memoir, Legacy: A Black Physician Reckons with Racism in Medicine, described by Jacqueline Woodson as a battle cry, and Ibram Kendi called it an illuminating and stirring journey, a journey where her twin sister, Dr. Oni Blackstock, also received her degree from Harvard, where they followed in their mother's footsteps, Dr. Dale Gloria Blackstock, making them the first Black mother, daughter legacies from Harvard Medical School. Dr. Uché Blackstock, welcome so much. I'm so glad you are here. You know that I've been stalking you in a sense. I heard about your work and I said, we've got to interview this woman. And here you are with your memoir. Talk to us about why you decided to write this book.
So first of all, thank you so much for having me here. I'm very excited to talk to you about legacy and my own journey from medical student to practicing physician. So I wrote legacy, and just so people know, it has a double meaning. It's, you know, the legacy of being a second generation Black woman physician, but it's also about the legacy of racism in medicine. And I wanted to help people connect the dots to why in 2024 we are still seeing these horrific health outcomes in our communities despite advances in innovation, research, and technology.
So many of us know and discuss endlessly the story of what happens to Black patients and the racism that they feel that they are experiencing in the medical system, no matter where you are in the country, you know, or whatever your economic status. There seems to be some issue, racial issue there. But what we haven't heard yet is your story of what the Black doctors are experiencing. And you quit your position and in no uncertain terms because you were miserable and felt that you just had to get out.
Yes, Carol, you know, when I was in that experience, I was in academic medicine for 10 years. I thought that I would spend my entire life career in academic medicine. That was my greatest hope. But here I was at NYU School of Medicine in the middle of the most diverse city, one of the most diverse cities in the country, and I was always either the only or one of two Black faculty in my department.
Always, still?
Yes, still. And, you know, I did not have mentorship, sponsorship. I kind of had to figure out the journey on my own, and I was very productive. I developed an ultrasound curriculum, the first ever for the medical school. I founded our department's ultrasound fellowship, and I was handpicked for a DEI role in the medical school, and I soon came to find out that that was just a figurehead position. They actually didn't want me to do anything.
Right.
And, you know, this happens very, very often. And in that role, I was silenced, I was muzzled, I was told that I couldn't speak up. And I kind of, it was very demoralizing. You know, just not having the support, I felt incredibly isolated. And at the time, I thought I was the only one that felt that way. So when I made a decision to leave, I said, I cannot be in this environment where I can't show up as my full, authentic self. And come to find out, this is the case for so many Black physicians.
This is extraordinary. We were talking a little bit before we started taping, and I said my best friend for many, many, many years was also a doctor, as was her husband. So I heard her stories through the years. But we, you know, are at least a couple of generations ahead of you, and I know that she always thought, you know, we're doing this so that the next generations don't have to do it. And here you are telling us now that you went through the same kind of obstacles and second guessing and non-promotion, non-recognition.
Right, yes. You know, I mean, people ask me, why did I leave and what was the moment that made me decide to leave? And it really was a series of experiences. You know, I went up for promotion. I was told that it would be a slam dunk. I had checked off all the boxes. I had done what I thought I was supposed to do. And I went up for promotion and it was denied. And that felt like a slap in the face. But a lot of times, the work that we do as Black faculty in terms of mentoring our students, that goes unrecognized. That's not appreciated as much as publishing articles in journals.
It's incredible, I mean, your entire story, the fact that you went through Harvard, both undergraduate and through the medical school, as your mother did. Let's talk about your mom for a bit, because I know that you know, and your sister used to do your homework in the lab, you know.
Yes.
You know, when she was working. So tell us how she got to Harvard Medical School. That was quite some accomplishment in her time as well.
It really was, and this book is really a love letter to my mother. She grew up in central Brooklyn to a single mom. She had 5 other siblings. They grew up in public assistance. My mother moved many times, changed schools many times, but she was very determined, had a curiosity for science, and became the first person in her family to graduate from college. She went to Brooklyn College and had a chemistry professor there, a Black man, who saw her potential and said, I think you should apply to medical school. And she did, and she was accepted to all her medical schools and ended up at Harvard Med.
Incredible, incredible. What year was that?
So that was, she entered in 1972 and then graduated in 1976. And just to say, around the time that she started Harvard Medical School, that was the time that the diversity initiative started after MLK Jr.'s assassination. So her class was actually one of the most diverse classes at Harvard Medical School.
And did she share with you, did you know that she was struggling then too in her medical profession? What did she say to her?
You know, I think even in medical school, you know, she felt like a fish out of water. She was in class with students whose parents had written the textbooks that they were using. One was
isn't that annoying?
I know. One was a family member of Jacqueline Onassis. Another one had won the Nobel Prize. Parent had won the Nobel Prize in immunology.
Right.
So, you know, like she felt like a fish out of water there, right? And she could have gone anywhere after that, after Harvard Med, but she came back to train at Harlem Hospital and then worked in central Brooklyn, in the same neighborhood that she grew up in, taking care of her family, friends, and neighbors.
That is so wonderful. And so here she has these twin girls who are doing their homework, watching her work, and they decide that they want to go to medical school too. So you both applied.
Yes.
Tell us about that.
Yeah, I mean, you know, I grew up thinking that most physicians were Black women.
Well, of course, that was your world.
That was my world. That was my world, and so you know, I saw my mother care for her patients in such a beautiful, dignified way. I saw the respect that her colleagues had for her. I saw the fact that she worked in service to our community, and so that was my inspiration. You know, and so yes, of course, there was no doubt that we would both my twin sister Oni and I would become physicians, right, and follow in her footsteps.
But to have it succeed that way, you know, so you both went through Harvard and came out, and did you in the beginning think this is different? You know, this is going to be different for me?
Yeah, I mean, I think I'm an optimist at heart, and so I did think that it would be different. I was, you know, probably a little bit naive. You know, I didn't have a lot of mentorship in medical school. Just, you know, as a Black medical student, there weren't a lot of Black faculty, and at that point, my mom had passed away, so I didn't have the opportunity to talk to her at that point in my life about, you know, what should I expect? Like, what's the environment going to be like? What are the choices I should make?
Right. And your mom passed away when she was 47.
Yes,
is that
yes.
So you're very, very young woman.
Yes, she you know, my mother was she led a very active lifestyle. She ran every day. She started running in medical school. She took great care of herself. And one summer when we were 18 years old, we ran races together in Central Park. And even though our mom was in our 40s and we were in our teens, she would come in, you know, before us. Like she just was very fast. And we ran a race together in Central Park, and she came in after us. And I said, Mama, are you okay? And she said, I feel really tired. A few months later, she was diagnosed with acute myelogenous leukemia, which is actually very rare for Black women to be diagnosed with. And I talk about that in the book, that it could have been that she was exposed to, some toxins or radiation early on in her life. But yes, so she passed away when we were 19 years old, and it felt like the rug was pulled up from underneath us. And yeah, I still grieve. I still grieve
Sure.
the loss of the time they would have had with her.
Right. But you are continuing the legacy in your work
Yes.
and in your memoir. And we should say your sister has also left
Yes.
the academic.
She was in academics, and then she became she was in a role at the New York City Health Department, Assistant Commissioner of the Bureau of HIV, and actually had the same experiences as a Black woman leader, being silenced, muzzled. And so she left and started her own health equity consulting firm like I did.
So now you both are outside of what people would call the system, and you are now advising. And with equity, equality of Black patients and doctors, I would presume now, at the forefront of your work. So tell us what's that daily work like now?
Yeah, so when I left academic medicine, I said, I need to be in alignment with what is important to me. And what was important to me was, how do we create diverse, inclusive workplaces in healthcare, like the one that I needed? And then how do we provide equitable care to Black patients? And so what both my sister and I do now is we work with healthcare organizations, health systems, startups. We go in and we do racial equity and health equity assessments. We talk to staff. We interview leaders. We do strategic planning around equity and do leadership coaching within equity as well. And so I feel like this is my opportunity to make a difference outside of the system.
So you're hopefully going to change the system as well, even though DEI is totally under attack now and assault. So, so there is that, a brand new obstacle put in your path. Do you experience that already?
We have been very fortunate that a lot of the organizations that we work with are able to kind of get around those issues. Like we find ways to, when we respond to a request for proposals from different organizations, there are a lot of them that actually want to do the work. So we still are quite busy with client organizations who are very committed to providing equitable care to our communities.
So let's talk a little bit about equitable care. And I, of course, I'm from Alabama. The Tuskegee syphilis experiment was, always outrageous.
Right.
And then the Henrietta Lacks, the taking of her cells, and all of the, rapacious actions against Black people. Are very much in most of our minds now, but we would think that would change as well. But I know that right here in New York City, if you're a Black woman and expecting a baby, what is the figure, like 9 times more likely to die?
Yes.
So talk to us about the health inequities.
Right. So it's interesting because a lot of times, what happens when Black people, when we interface with the healthcare system, we've seen these patterns of when we say we're having particular symptoms or we're in pain, often health professionals will dismiss or ignore our concerns. And we even see that with someone as famous as Serena Williams, the greatest
Precisely.
athlete of all time, who had a blood clot previously and then was complaining of symptoms to her medical team. And they would not listen to her, and she ended up having a blood clot in her lungs. And so what we see is often Black patients are not listened to. And what that results in is delayed diagnoses, misdiagnoses, harm, and sometimes even death. And often there's this idea, and I talk about this in the book, that because of these deeply rooted myths about Black people being biologically different,
in particular, being able to sustain deeper pain,
exactly,
and not needing medicine.
Right. It's horrible. So our pain is not adequately treated. I talk about a study in 2016 at the University of Virginia, where they gave mock cases to medical students and residents. The only difference was the race of the patient. And those medical students and residents consistently underrated the Black patient's pain and gave less pain medication to the Black patient.
You know, I mean, it's so infuriating. So many experiments that were done on Black patients without any kind of pain medication as well. So that there's the Black maternal health issue that we all know. I mean, indescribably frustrating, because no matter what your economic status is, your education, your whatever,
Right. It's not protective for us. You know, we're you know, people will say, oh, well, the reason why we're seeing Black people with these poor health outcomes is because of socioeconomic status. But we know, even myself as a Black woman with a Harvard undergraduate degree and medical degree, I'm still 5 times more likely to die of pregnancy-related complications than my white peers. I have access to quality health care. I have access to culturally responsive healthcare, but still, and so I think it's important for people to understand that, you know, when we interface with health professionals, there is that bias, but also the chronic stress of living with everyday racism causes a wear and tear on our bodies that the public health researcher Arlene Geronimus termed weathering.
weathering, right, right.
Yeah.
So our bodies are worn out. We'll go into more detail about it, because I think it's been demonstrated that you're chronologically aged by just dealing with micro or macro aggressions throughout your life.
Yeah, so there's this idea that because we have to deal with, you know, everyday racism, systemic systemic racism, that our body experiences this wear and tear that makes us more susceptible to developing chronic diseases or, you know, having complications at pregnancy and during birthing. So, you know, we need to really understand that it's not even just about what happens when we go seek health care or you know, or care in general, but what happens just in our everyday life, that, you know, we are dealing with this chronic stress of racism that actually increases the stress hormone cortisol. Our body is not used to having persistently elevated levels of cortisol. That's a stress hormone. And so that's why we think that it's likely, the reason why we are more likely to have diabetes, high blood pressure, autoimmune disease, heart disease, is because of dealing with that chronic stress.
Well, that's quite something. And there was the Flexnor report. Talk to us about
Yes. So, you know, it's interesting. You know, you know, we talked about these anti-DEI initiatives that are coming out now. We talked, even the recent SCOTUS decision in race-conscious admissions. I was in a conversation yesterday with Congresswoman Ayanna Pressley, and she talked about how certain policies are policy violence. And so we see that with the Flexner report in 1910. We look today and say, why are there so few Black physicians? It's not because there's something inherently wrong with Black people trying to become doctors. It's because there was this policy in 1910. It was commissioned by the American Medical Association and the Carnegie Foundation, and they sent educational specialist Abraham Flexner to assess all 155 US medical schools and Canadian medical schools. And he held them against the criteria of Western European medical schools and Johns Hopkins. Anyway, his report in 1910 led to the closure of 5 out of 7 of the historically Black colleges and universities, leaving behind Howard and Meharry. It's estimated if those 5 medical schools have remained open, they would have trained between 25,000 and 35,000 Black physicians.
And most of the Black physicians that we have now are coming out of the Black colleges, right?
Still, our historically Black colleges and universities still carry the burden of educating the most Black physicians. Even with all of the other predominantly white medical schools out there, Howard and Meharry still put out the most Black physicians.
Well, Marian Wright Edelman, who is a hero of mine, has done so much for children in poverty, children's lives, and she says you can't be what you don't see. A very good quote of hers in terms of Black students who decide to become doctors. They need to see doctors. You needed to have doctors Black doctors to mentor you.
Absolutely. You know, I think about, my career in academic medicine, how I had to figure out a lot on my own. because I didn't have that mentorship. And we know in terms of mentoring, people are more likely to mentor people that they look like, or have something familiar with. And so if there are very few Black faculty, there are very few people there to mentor our students or junior faculty. And so I actually grieve what I could have had in my academic career had I had that.
How do we change this? You know, you're helping the institutions understand what's going on, what they possibly are doing wrong, and how they can make things better. But where do we get the medical students? How does that work?
Yeah, in the book, I have a call to action in the last chapter where I task different groups with, different responsibilities. Like, this is your obligation. I think for medical schools, there is so much work that they have to do in terms of, I talk about how I had to unlearn and relearn as a practicing physician what I did not learn in medical school. So the HeLa cells, I didn't know, we were using those in my histology class. I didn't know that they were from Henrietta Lacks until I was a practicing physician. And when I did, I grieved that. So these are that's the content that medical students need to know. They need to understand how systemic racism, how slavery, how policies like redlining impact Black health today. They also need to recognize their own internal biases. So I think medical schools really need to be intentional about integrating health equity into the curriculum. And they also need to work with their faculty, because a lot of the faculty, they were trained, decades ago. A lot of the students, they're more savvy about these issues than the faculty are. So medical schools have a huge responsibility in terms of how we're educating our future physicians.
And in terms of what you say to families who are facing the medical systems, it's quite something. If you have a doctor, if you can get a doctor, and if you can get treated well. I was just talking with someone who's working with children in poverty and saying that the reason they had to be of use to the family was that the family did not speak English, and they didn't know that what the doctor had said to them was that their child had a brain tumor. They had no idea what was, and they had no translator, so there are these huge blocks, presented to families.
Yes, and it's interesting because with that question, it's challenging for me because I say, it shouldn't be up to the patients to feel like when you go into a healthcare setting that you're going to war, that you have to be armed with all of these resources, right? It's really systemic issues. But of course, I tell people that you should always bring either a trusted friend or loved one with you.
Do not go alone.
Don't go alone.
That's right.
Yeah, don't go alone. And it's interesting, there was this viral TikTok video that came out a few weeks ago of a white doctor who said, I notice a lot of my Black patients come to appointments with FaceTime, with a family member on FaceTime. And I don't understand this.
But
it's because we know that we need to have someone else there to make sure that we're asking the questions that we need to ask, that we're being treated with respect and dignity in that interaction. That's why. So I always recommend bringing a friend or a family member with you to an appointment. Very important.
Right, and it goes just against the way many of us would respond to say, oh no, I can handle this on my own, and months down the line, you find out, no, you needed somebody in that very first meeting. Do not go alone. Now, that says so much about America and the medical system and racism, that you are not to be trusted by yourself in a doctor's office, that you need a corroborating source.
Yeah, absolutely. And I also tell people, I don't have a problem with patients doing research on what's the symptoms that they're having. I also recommend that people come to appointments, with writing down what symptoms they're having, the duration of symptoms, coming with clear questions for their doctor saying, what do you think is going on? What is your plan for me? What is the follow-up? So making sure that you have all of those questions ready, you can even put it in your phone or have a notebook, but making sure that you are asking those questions. You shouldn't have to, but, leaving that interaction with that health professional, knowing that you have all the information that you need.
Your mom had a quote, we do not have a healthcare system in place that is equitable for all participants. Worse, a healthcare system that refuses to embrace all in need. How do we make that change? So in essence, she saw this, and now you are and your sister are affecting it. Tell us about what the next steps are.
Yes, yeah, you know, so in that call to action I have, not just for medical schools, but I have it for white health professionals. I tell them that, you know, your patients, your Black patients are dying, your Black colleagues are doing the work. We need you to also do the work. We need you to understand how your internal biases impact the care that your patients receive. We need you to speak up when you see Black faculty leaving, your colleagues leaving an institution. You know, you need to say something. But I also talk to policymakers, because we know that health is not just about healthcare, right? We know that health is about giving our communities the resources that they need so people can lead full, healthy lives. So we talk about, you know, the education pipeline, you know, giving opportunities for home ownership for Black people so that we can, you know, have generational wealth that we've been deprived from for so long. So we call those the social determinants of health. Systemic racism impacts that. We see that from redlining. We see that neighborhoods that were redlined today have the very worst health outcomes. So I ask policymakers to think about health in all policies. How can we make Black communities healthier?
Great, great. And you apparently do several affirmations every day. If you could leave us with those so that we can start doing them ourselves.
Yes, so actually I also do affirmations with my children. You know, I have two Black boys, 7 and 9 years old, and we have a list of affirmations that we do every morning. And they said, I love my skin. I am a good person and a good friend. I'm proud of my history. I want to make a difference in the world. And so that's the same for me.
Ah, that's perfect. That is perfect. Uché Blackstock, thank you so much, Doctor, for being here with us and telling your story, for writing your memoir. It is important for all of us to read, and I thank you so much for doing this and for sharing the experience you've had.
Carol, thank you so much for having me. This was a pleasure.
Great, great. So our thanks to Dr. Uché Blackstock, an emergency medicine physician, founder and CEO of Advancing Health Equity, and author of Legacy, a Black physician reckons with racism in medicine. That's it for us. I'm Carol Jenkins. The program is Black America. We'll see you the next time.